Okay, so the summary of today's question is, does insurance cover right-sided TMS for anxiety? I think this was a follow-up question on one of my previous videos. It comes from one of our YouTube subscribers. The question is, isn't anxiety one of the symptoms of depression, or will insurance not cover that symptom? And thus, the doctor cannot stimulate the right DLPFC unless the patient pays out of pocket. Okay, so basically what the person is asking, hey, why is my doctor not giving me the treatment for an anxiety, saying that I need to pay out of pocket for it, because it's for an anxiety, and the treatment that I'm approved for is for depression. And if you're looking at depression symptoms, one of them is anxiety, right? One of the rating scales for the 99 questions is increased agitation or anxiety or worries or what have you and stuff of the sort. So you're correct on the part that, anxiety is one of the 9 symptoms for depression. Also, you are correct on the fact that anxiety and depression are comorbid, there is higher chances of having anxiety if you have depression, and vice versa. Those numbers are between 60 to 80% overlap between the two disorders. Okay, but back to answer the question. The left-sided activation, high frequency TMS, 10 hertz stimulation on the left side, on the left DLPFC, or theta burst stimulation on the left DLPFC, that's the left area of the brain that we stimulate. This is FDA cleared, it's paid for by insurances, and everybody is established that it helps with depression. Now we could use low frequency TMS on the right side. So the same coil, the figure of 8 coil, we put it on the other side of the brain, and we do 1 hertz. 1 hertz means 1 click a second. So it sounds like a clock ticking. It sounds like click, 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 and it's just 1 click every second. So that's 1 hertz or low frequency, and that one could help with anxiety. The evidence behind the right-sided treatment for anxiety is not as well established as the high frequency 10 hertz DLPFC or a theta burst stimulation for the left DLPFC. So for this reason, when insurance companies were making their policies, they said it's only for depression. They did not approve it for anxiety. That being said, he recently DTMS, Brainsway claims DTMS to stand for deep TMS, and they trademark that. I call it diffuse TMS, so they can't go after that trademark of diffuse TMS. But anyways, there is a different coil called H coil. So H1 coil stimulates larger area of the brain. So it's placed in a helmet, it's housed in a helmet, it's placed on the patient head, and it's tilted towards the left DLPFC. But despite the fact that it's tilted a little bit, it still stimulates larger area of the prefrontal cortex. And for this reason, we consider it to be diffuse TMS. Yes, it stimulates deeper structure of the brain, but they don't really, neither coil reaches deeper structure. We're still within the cortex for both coils. So it doesn't really matter, that it's a little bit deeper. What matters is it's more diffuse, so it stimulates larger area of the brain. That particular coil, these folks at Brainsway are really good at clinical research, right? So they collected their data and they found out that patients who are treated with this coil have less anxiety symptoms when they have the comorbidity of anxiety and depression. And they submitted that to the FDA, and now they have an FDA clearance for anxious depression. What does that mean? It means major depressive disorder with anxious distress features. So if somebody has clinical depression, but they have comorbid anxiety, then that coil can help with both. We already know that. We already, know that treatments of depression could actually help with anxiety. And they can't really take that coil and put it on the right side based on that clinical data, because that clinical data did not include switching the coil to the other side and putting low frequency TMS. So basically, TMS is now FDA cleared for anxious depression, basically anxiety comorbid with depression, but not in a new treatment protocol. It's still the left-sided DLPFC. Why am I giving you all of this long answer? Because your doctor is correct on one part, which is we don't really need to change the location of treatment. We just need to treat the left DLPFC at high frequency. If your patient has a judgment that your depression is improving but your anxiety is not improving, and off-label they want to put the coil on the other side and do low frequency TMS, then insurances are not going to cover for that. So it depends on the clinic that you're going to. Some clinics will ask you for add-on treatment, and this add-on is basically how do I say that in good English? It's a BS marketing thing that was created by a company called Neuronetics, to kind of try to milk patients and get as much money as possible out of that. It should not be the case. If somebody needs an extra treatment, it should be for free. I'm not saying free, I'm meaning that you already paid for the time on the chair, whether your doctor is using that mostly to do left-sided treatment or some of that for left-sided treatment and some of that for right-sided treatment, it should be the same amount of money. But that particular company sells their device based on what they call pay-per-use. So if somebody was doing left-sided treatment and then they need to do right-sided treatment, so that company wants to make money twice, and then they force the clinic to charge the patient extra and what have you, that makes no sense. So in our practice, for example, we book a patient on the chair for 45 minutes, though they only need 19 minutes on the chair for left-sided high-frequency treatment. If I ordered the patient to also have right-sided treatment for 15 minutes or 20 minutes, then they don't get charged for it, and it's still within the 45 minutes that we booked for the patient. Now, why did we book 45 minutes rather than 30 minutes? Because COVID and what happened, and making sure that we don't have a waiting room and patients are not, if somebody's like 5 minutes delayed in traffic and what have you, that doesn't delay the next patient and the patient after and what have you and stuff of this sort. So it's more of like a workflow kind of situation. But the short answer to this is that hopefully the clinic that you go to, they know different modalities of treatments, and if an extra modality of treatment is needed and you're already covered by your insurance for the primary reason, they don't charge you for the extra treatment. But if you don't have an option, you have only one clinic in town that does this particular treatment, and you were improving on the left-sided treatment with high frequency and for your depression, and you were not doing as well in terms of an anxiety, and they propose maybe you might need right-sided low-frequency TMS for the reason of an anxiety. There are some data that supports that, and insurance does not cover for it, so the patient has to pay out of pocket for it. All right, hopefully this answer helps. Thank you. Disclaimer: although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.